Today we're diving deep into a health concern that affects millions worldwide: diabetes. Recognizing the early signs of diabetes is crucial for early intervention and management. Diabetes is a serious condition that can lead to severe health complications if left unmanaged. In this video, we'll explore 10 alarming signs of diabetes you absolutely must know. And trust me, you won't want to miss number 10. It's a very dangerous sign that you need to be aware of. So stay tuned and make sure you watch till the very end. Frequent urination, especially at night, might seem harmless but can be a red flag. If you're constantly running to the bathroom, it could indicate high blood sugar levels. High blood sugar, a hallmark of diabetes, makes your body flush out excess sugar through urine. This process also pulls water from your body, leading to more frequent urination. If you're noticing a sudden increase in bathroom trips, especially at night, don't ignore it. It's essential to bring this up with your doctor for simple tests to check your blood sugar levels. Now let's talk about another common sign of diabetes that often goes hand in hand with frequent urination: excessive thirst. If you're constantly reaching for your water bottle and find yourself feeling parched no matter how much you drink, your body might be trying to tell you something. Remember how we talked about frequent urination being a way for your body to flush out excess sugar? Well, all that peeing can lead to dehydration, which in turn triggers an intense feeling of thirst. But here's the catch. Even if you're guzzling down water like it's going out of style, you might still feel thirsty. That's because diabetes affects your body's ability to regulate fluids properly. So, that unquenchable thirst you're experiencing could be a sign that your blood sugar levels are out of whack. If you're concerned about excessive thirst, don't hesitate to reach out to your healthcare provider. They can help determine the underlying cause and recommend the appropriate course of action. Losing weight without even trying might sound like a dream come true for some, but trust me, when it's unexplained, it's not a good thing. In fact, it can be a warning sign of diabetes. You see, diabetes throws a wrench in your body's ability to use glucose, a type of sugar, for energy. When this happens, your body starts looking for alternative fuel sources, and guess what it turns to? That's right, your muscle mass and fat stores. As your body breaks down muscle and fat for energy, you'll likely experience weight loss, even if you haven't made any changes to your diet or exercise routine. Now, it's important to note that unexplained weight loss can be attributed to a variety of factors, not just diabetes. However, if you're experiencing significant weight loss without any obvious reason, it's crucial to get yourself checked out by a medical professional. They can help rule out any underlying health conditions and provide appropriate guidance. Are you constantly rummaging through the pantry feeling like you could eat a horse? Increased hunger, or polyphagia, as it's medically known, is another telltale sign of diabetes. Here's the deal. Your body needs glucose for energy, right? But with diabetes, your cells aren't getting enough of this vital fuel because either your body isn't producing enough insulin, or your cells are becoming resistant to its effects. Insulin is like a key that unlocks the doors of your cells, allowing glucose to enter and provide energy. So, when there's an insulin problem, glucose can't get into your cells effectively, leaving them starved for energy. Your brain senses this energy deficit and sends out powerful hunger signals, urging you to eat more in an attempt to compensate. If you find yourself constantly battling cravings and feeling like you're never full, it's essential to consult with your doctor. They can assess your overall health and determine if diabetes is the underlying cause of your insatiable appetite. Feeling tired all the time, even after a good night's sleep? We all experience fatigue from time to time, but if it's persistent and interfering with your daily life, it could be a sign of something more serious, like diabetes. Remember how we talked about glucose being the primary source of energy for your body? Well, when you have diabetes, your body struggles to utilize glucose effectively, leading to an energy shortage. Imagine your cells are like cars, and glucose is the fuel they need to run. With diabetes, it's like your cars are running on fumes because they can't access the fuel they desperately need. As a result, you feel exhausted, both physically and mentally. If you're constantly battling fatigue and it's affecting your quality of life, don't ignore it. Talk to your doctor about your symptoms. They can help you determine the underlying cause of your fatigue and recommend appropriate treatment options. Now let's talk about a symptom that can directly impact your blurred vision. If you're noticing that things are looking a little fuzzy or you're having trouble focusing, it's essential to pay attention. High blood sugar levels, a hallmark of diabetes, can wreak havoc on your eyes, particularly the lenses. The lenses of your eyes are responsible for focusing light onto the retina, allowing you to see clearly. However, when your blood sugar levels are consistently elevated, it can cause the lenses to swell, disrupting their ability to focus properly. Think of it like this. Imagine trying to look through a window that's covered in condensation. The blurry appearance you experience is similar to what happens to your vision when your lenses swell due to high blood sugar. If you experience sudden blurred vision, especially if it's accompanied by other diabetes symptoms, it's crucial to seek immediate medical attention. Chapter 7. Slow healing of wounds. What's the connection? Have you noticed that cuts, scrapes, or sores seem to be taking forever to heal lately? High blood sugar levels can disrupt the healing process. High blood sugar damages blood vessels, affecting oxygen and nutrient delivery to tissues. This disruption hampers the healing process. If you're concerned about slow healing wounds, consult your healthcare provider. They can assess your health and recommend treatment options. Experiencing tingling, numbness, or a pins and needles sensation in your hands or feet? While these sensations can be caused by a variety of factors, they can also be a red flag for nerve damage, a common complication of diabetes. High blood sugar, if left unchecked, can gradually damage the delicate nerves throughout your body, a condition known as diabetic neuropathy. The nerves in your extremities, particularly your hands and feet, are often the first to be affected. Think of it like this. Imagine a garden hose that's been kinked or twisted. The flow of water through the hose becomes restricted or blocked altogether. Similarly, when nerves are damaged by high blood sugar, the transmission of signals between your brain and the rest of your body is disrupted, leading to tingling, numbness, and pain. If you're experiencing these symptoms, it's crucial to consult with your doctor to determine the underlying cause and receive appropriate treatment. Have you noticed any dark, velvety patches of skin on your body, particularly in areas like your neck, armpits, or groin? These patches, known as acanthosis nigricans, can be a sign of insulin resistance, a condition that often precedes type 2 diabetes. Insulin resistance occurs when your cells don't respond properly to insulin, the hormone that regulates blood sugar levels. As a result, your pancreas has to work overtime, producing more and more insulin to try and lower your blood sugar. This excess insulin circulating in your bloodstream can stimulate the overgrowth of skin cells, leading to the development of acanthosis nigricans. While acanthosis nigricans itself isn't harmful, it's a visible clue that your body might not be processing insulin effectively. If you notice these dark patches on your skin, it's essential to bring it to your doctor's attention. They can assess your overall health, check your blood sugar levels, and recommend appropriate steps to improve your insulin sensitivity. And now, for the 10th and final alarming sign of diabetes, frequent infections. If you find yourself battling one infection after another, your body might be trying to tell you something's not quite right. High blood sugar, a hallmark of diabetes, can weaken your immune system, making you more susceptible to infections. Your immune system is like your body's defense force, constantly on the lookout for invaders like bacteria and viruses. However, high blood sugar creates an environment where these harmful microbes can thrive. Think of it like this. Imagine a castle with weakened walls and a depleted army. It becomes much easier for invaders to breach the defenses and cause havoc. Similarly, when your immune system is compromised by high blood sugar, your body becomes more vulnerable to infections. If you're experiencing frequent or recurring infections, it's essential to consult with your healthcare provider. They can assess your overall health, check your blood sugar levels, and recommend appropriate strategies to boost your immune system. Let's talk about blurred vision. It's a common issue that many people experience at some point in their lives, but it can be more than just a minor inconvenience. It's more than just needing glasses. Blurred vision can be a symptom of various underlying health conditions. One of the most concerning causes of blurred vision is high blood sugar levels, which can be a sign of diabetes. You see, when your blood sugar spikes, it can actually cause the lens in your eye to swell up. This swelling distorts the shape of the lens, making it difficult for your eyes to focus properly. This swelling makes it tough for your eyes to focus properly, and boom, blurry vision. It's like trying to look through a foggy window. Now don't freak out if you have blurry vision every now and then. Occasional blurred vision can be caused by something as simple as eye strain from staring at a computer screen for too long, or needing a new prescription for your glasses. It could be due to a number of things like eye strain, or even just needing a new prescription. However, it's important to pay attention to the frequency and duration of your symptoms. But if you're noticing persistent blurred vision, especially if it's accompanied by other symptoms we'll be talking about, it's definitely time to get checked out. Persistent blurred vision can be a warning sign that something more serious is going on with your health. It's definitely time to get checked out. Early detection is key when it comes to managing diabetes and preventing complications. Regular eye exams can help catch these issues early on. Early detection is key when it comes to managing diabetes and preventing complications. By keeping an eye on your vision and getting regular checkups, you can take control of your health and catch potential problems before they become serious. Remember, maintaining a healthy lifestyle, including regular exercise and a balanced diet, can help manage blood sugar levels and reduce the risk of complications. So take care of your eyes and your overall health. Stay informed, stay proactive, and don't hesitate to seek medical advice if you notice any changes in your vision. Your eyes are a window to your overall health, so keep them in check. Ever notice how cuts and scrapes seem to take forever to heal when you have diabetes? Well, there's a reason for that. High blood sugar, over time, can actually damage your blood vessels, including the tiny capillaries that carry blood to your tissues. This damage makes it harder for your body to deliver the nutrients and oxygen needed for healing. So if you're noticing that even minor wounds are taking their sweet time to heal, it could be a sign that your blood sugar isn't under control. Don't ignore this, it's your body's way of telling you something's up. Okay, let's talk about those pins and needles sensations. You know, that tingling or numbness you sometimes feel in your hands or feet? That's not something to ignore, especially if it's happening frequently. This is a condition called neuropathy, and it's a common complication of diabetes. High blood sugar can damage the nerves in your extremities, leading to these uncomfortable sensations. In the beginning, you might just notice a little tingling, but over time, it can progress to numbness, pain, and even problems with balance and coordination. So, if you're experiencing any of these symptoms, don't brush them off. Get yourself checked out. Have you been getting sick more often than usual? Colds, urinary tract infections, skin infections, they seem to be hitting you left and right. Well, this could be another sign that your blood sugar is out of whack. See, high blood sugar weakens your immune system, making it easier for those pesky germs to take hold. Your white blood cells, which are your body's infection fighters, don't function as well when your blood sugar is high. So if you're finding yourself reaching for the tissues or antibiotics more often than usual, it's worth getting your blood sugar checked. Now, this next one might seem a little strange, but trust me, it's important. Have you noticed any dark patches on your skin, especially in areas like your neck, armpits, or groin? These patches, often called acanthosis nigricans, can be a sign of insulin resistance. Insulin resistance is basically when your body's cells don't respond to insulin as well as they should, leading to high blood sugar. These dark patches are often velvety in texture and can be an early warning sign of diabetes, so if you spot them, don't ignore them. Let's talk about thirst and hunger. Two things we all experience, but they can be signs of diabetes if they're excessive. Thirst and hunger are natural signals from our body, but when they become extreme, they can indicate something more serious. Imagine constantly feeling the need to drink water, yet never feeling satisfied. This isn't just a minor inconvenience. It can be a sign that your body is struggling to manage its blood sugar levels. When your blood sugar is high, your body tries to flush out the excess sugar through your urine. This is your body's way of trying to maintain balance. The kidneys work overtime to filter out the sugar, leading to frequent urination. This process is not only exhausting but also depletes your body of essential fluids. This process requires water, which is why you feel extra thirsty. Your body is constantly signaling you to drink more to compensate for the loss. However, no matter how much you drink, it never seems to be enough. This relentless cycle of drinking and urinating can leave you feeling drained and frustrated. And even though you're drinking more, you might still feel dehydrated because you're peeing so much. The dehydration can lead to other symptoms like dry mouth, headaches, and even dizziness. It's a never-ending loop that can significantly impact your daily life and overall well-being. Now, about that hunger, high blood sugar also prevents glucose from entering your cells properly, so your body doesn't get the energy it needs. This lack of energy can make you feel constantly hungry no matter how much you eat. Your body is essentially starving for energy, leading to frequent and often unsatisfying meals. This triggers your brain to send out hunger signals, even if you've recently eaten. It's a vicious cycle. The more you eat, the more your blood sugar rises, and the more your body struggles to use that sugar effectively. This can lead to weight gain, fatigue, and a constant feeling of frustration. Understanding these symptoms is crucial for managing diabetes and breaking the cycle. Okay, I know what you're thinking. Weight loss is a good thing, right? Well, not always. If you're losing weight without trying, especially if it's a significant amount, it could be a red flag for diabetes. When your body can't use glucose for energy efficiently, it starts breaking down fat and muscle for fuel instead. This process leads to weight loss, but it's not the healthy kind. It's your body's way of trying to compensate for the lack of glucose in your cells. So, if you're experiencing unexplained weight loss, don't just celebrate, get yourself checked out. Feeling tired all the time, like you could sleep for a week straight? Fatigue is a common symptom of many conditions, but it can also be a sign of diabetes. Remember how we talked about your body not getting enough glucose for energy? Well, that lack of energy can leave you feeling exhausted no matter how much sleep you get. It's like your body is running on fumes. So if you're constantly feeling drained, even after a good night's rest, it's worth considering diabetes as a possible cause. Always running to the bathroom, especially at night? Frequent urination, also known as polyuria, is a classic sign of diabetes. As we discussed earlier, your body tries to get rid of excess sugar through your urine. This means your kidneys are working overtime, producing more urine than usual. You might find yourself waking up multiple times during the night just to pee, which can disrupt your sleep and leave you feeling exhausted. So, if you're noticing an increase in bathroom breaks, don't ignore it. Now for the sign you absolutely don't want to ignore, diabetic ketoacidosis or DKA. This condition is a severe and potentially life-threatening complication of diabetes that demands immediate attention. DKA occurs when your body starts breaking down fat for energy at a rapid rate because it can't use glucose properly due to a lack of insulin. This is often triggered by factors such as missed insulin doses, illness, or infection. This fat breakdown process produces ketones, which are acidic byproducts. Normally, insulin helps glucose enter your cells to provide energy, but without enough insulin, your body resorts to fat as an alternative energy source. When ketones build up in your blood, it can lead to a dangerous condition called ketoacidosis. The high levels of ketones make the blood more acidic, which can disrupt the normal functioning of your organs. Symptoms of DKA include excessive thirst, which is your body's way of trying to flush out the excess ketones through urine. Frequent urination follows as your kidneys work overtime to eliminate the ketones. Nausea and vomiting are also common as your body reacts to the high acid levels. Vomiting, abdominal pain, and a fruity-smelling breath are telltale signs of DKA. The fruity smell is due to the presence of acetone, a type of ketone, in your breath. Confusion and difficulty breathing are severe symptoms indicating that the condition is worsening. DKA is a medical emergency and requires immediate attention. If left untreated, it can lead to severe dehydration, coma, and even death. If you experience any of these symptoms, call 911 or get to the nearest emergency room right away. Early intervention can be life-saving, so don't hesitate to seek help immediately.